This journey started about 3 years ago when the Kootenai Health Board and leadership developed a new vision for the organization, and we made a commitment to grow this really good community hospital to become a comprehensive regional medical center. And so we begin the process and journey of adding new services to our facility, new clinical programs for our patients, and that process has been very successful. In fact, our volume and revenue have grown by 35% in just 3 years. As a result of that, we've experienced significant facility capacity constraints, and the hospital board has therefore made a commitment to a large 100,000 square foot expansion of the hospital. We intend to break ground this June, and the project will be comprised of several different components.
The new expansion is 3 floors. You'll enter into a brand new lobby, easy to find, welcoming space. Immediately to your left, on the first floor, will be the new Family Birth Center. In there, we will have 10 labor and delivery rooms, 18 postpartum rooms, 12 neonatal intensive care rooms, 2 C-section ORs. It'll be wonderful, warm space for our women's and children's services. On the second floor will be a new 32-bed patient care unit. Orthopedics and neuro will be the patients who will be cared for on this floor. And the third floor will eventually be another 32-bed unit that will build out as our volumes continue to increase.
The master facility plan is really just a guideline to how the hospital would grow over the next 10 to 15 years. Then you begin design and actually start refining and really getting down into the nuts and bolts of what those needs really look like and how to fulfill them with the design. The expansion from the north to south end is over 460 feet long, which is huge. That's a football field and a half.
A couple of the key things that we wanted to include in the design elements were, from a patient's perspective, how do we ensure privacy and comfort for our patients? And so the room design, the interior design, the wayfinding, the flow, all within a warm, light, healing environment were really key to the design of the new hospital.
We plan to fund this project through debt financing and as a community-owned hospital through the generous contributions of community donors through our Kootenai Health Foundation. We have lots of capital needs over and above this project, so we have to replace equipment, we have new technology, sometimes we have to replace a roof. So we'll be using operational cash and cash reserves for those expenditures. Kootenai Health has not assessed property taxes since 1995. We don't plan to assess taxes for this project or any other project in the future.
This will be the largest single expansion in the history of Kootenai Health, and the largest recent expansion was 30 years ago. So in some ways this is a long overdue expansion and improvement of the hospital for our community.
We would like to be able to keep families in their home community. We're going to be able to have moms come in, they can give birth, and in that new neonatal intensive care unit, the moms will be able to stay right in the room with their baby. We would like to be able to keep these babies here in Idaho, even down to 1 pound or as much as 12 weeks early. That's level 3 care, and this new facility will allow us to do that.
Our children, Ryan and Riley, were born 2 months premature. Living in Coeur d'Alene and delivering my kids in Spokane was difficult. You know, we had no choice. That was where our doctors sent us. That's where the doctors that could help us, they were there. The facility was there. It was tough for me. I wanted my family there. I wanted everybody in the room. I had these visions of, it didn't turn out the way I thought.
If Kootenai is able to provide those services here, it would have made it a much easier on the family as a whole, you know, trying to keep the family, you know, my wife was in the hospital, my kids were in the hospital, and, you know, trying to keep the household, it can be stressful on a family. I think that the families of North Idaho are going to benefit from this tremendously when Kootenai Health has a neonatal unit on site.
Women and Children's Services is a gateway. This is how families come into care. If you want to support healthcare in a community, you start with Women and Children's Services. When a mom comes in to have a baby in a facility, that's where next year she's going to bring her ailing grandmother. That's where 5 years from now she's going to suggest to her friends that they bring their sick nephew. This is how we involve families. This is the heart of the matter. It's emotional, it's physical, it's family-centered. It's the most important place we can start. When it comes from the point of view of the contributor, if you want bang for your buck, if you want to put your money a place where it's going to make a difference, start with newborn services.
You know, the reason we all work in healthcare is we're here to serve. And so ultimately, it's not about just the bricks and mortar and the new technology and the growth plans. It's about providing the best service possible for every patient one day at a time.